Hello, dear listeners. I'm Nermeen Abdelhamid, Communications and Visibility Officer at the United Nations Office on Drugs and Crime, UNODC, the regional office for the Middle East and North Africa. And today's episode of the Global Compact for Migration podcast series is under the title of Strong Migrant Families Stronger Together During COVID-19 and is brought to you by UNODC. The Global Compact for Migration podcast series aims to have a conversation with people from across the Middle East and North Africa during GCM's regional review on the importance of making migration work for all and to reflect on the GCM 23 objectives and their associated actionable commitments to help achieve safe, orderly, and regular migration. Today, I'm very glad to be speaking with Dr. Wadie Maalouf, Coordinator for Global Program on Prevention of Drug Use, Crime, and Violence at the Health Branch within UNODC. Thank you so much for being with us today, Doctor.
Thank you for having me here, Nermeen.
As we all know, families around the world are adapting to the changes that are happening because of COVID-19. Many parents will find it stressful to balance work, caring for children, and maintaining the household, particularly when separated from their regular support networks. While quarantine can represent an opportunity to spend time together and develop your relationship with children, many caregivers will be experiencing conflicting feelings and priorities, as well as practical challenges. And as part of Objective 7 of the Global Compact for Migration or the GCM, addressing and reducing vulnerabilities in migration is very important. And in general, it's vital to support migrant caregivers and children who may be living in difficult or stressful settings. What do you think are ways to do so?
Well, this is a very interesting question, just as at the outset, it's important to highlight that the main vulnerability framework that we usually address, regardless of the setting, in order to prevent negative and social health outcomes in youth, requires that we focus on the individual vulnerabilities. So basically, vulnerabilities that the person at the individual level faces: mental health, personality traits, neurological development, reactivity to stress, and beyond, as well as the environment around that person, that individual, that support or accentuate these vulnerability. The family, how it functions, the relationship, school influences, peer influences, but even these microstructure exist in a larger structure of a certain economic situation, a physical environment, or social and environmental pressure like migration, like conflict and post-conflict situation and beyond. So our role is to support as much as possible the individual resiliences, while also supporting the structure around that individual to kind of strengthen these resiliences in that individual. Needless to say that parenting is usually requires specific skills, but migration is difficult on families, on individuals within the families and other families, but also forced migration is particularly stressful. Families remain in these circumstances the main social institution to provide support around the lives of these children. It's the only institution in these circumstances that provide support. So that's why arming caregivers with proper caregiving skills in these circumstances is very important, while at the same time it's very challenging because parenting in stressful situation is difficult than normal parenting. And that's why specific tools are needed for these circumstances. And this is why UNODC used its experience on parenting and evidence-based implementation of evidence-based family skills program to develop a program called Strong Families as one of the main tools designed to support caregiving under stressful circumstances. It's light. It's in the sense of it doesn't require lots of equipment to be done. It's brief in terms of number of sessions. It's designed to be selective, but universal within its selectivity, means every family that is under these circumstances can benefit from it, but not for a specific group of families within these structures. And it's relied on evidence. It capitalized on the evidence of UNODC piloting evidence-based programs for over a decade in different countries, but also it was field tested in many countries. It first was piloted in Afghanistan, in 3 different places in Afghanistan. It was replicated later on Afghan refugees that were in Serbia, stranded in Serbia, to test its effectiveness and its feasibility. But then now it's available in over 20 languages, including with the support of our regional office in Middle East and North Africa and Arabic. And it's been piloting in 20 countries, including, I give for example, in Iran, in the Philippines, in natural disaster areas of the Philippines and conflict areas in the Philippines, in Indonesia, in Mexico, and most recently among Rohingya refugees in the Cox's Bazar region of Bangladesh, together with UNHCR.
This is very, very interesting. And also, as you mentioned, how migration in itself without COVID-19 can be difficult. And seeing that COVID-19 adds a burden, how could such a situation of balancing life and family during COVID-19 within a crowded setting be handled?
You mentioned it right. I mean, it's that balancing, that's the skill. Further to the stresses that I mentioned before, the context COVID-19 can be seen in different perspective. COVID-19, its direct viral threat is a stress that is added to the existing stress. But also COVID-19 as a phenomenon and the social preventive strategies around COVID-19 are also added stress on these families in those circumstances. The lockdown, the isolation, physical distancing, closing of schools, the socioeconomic impact of, from loss of jobs to rise and all the stresses that are linked to it are all added phenomenons that sort of raise the vulnerability and parenting under circumstances, the challenges of parenting under these challenges. So there are reports of rise on violence against children, and needless to say that our task remain responding to as UNODC to our mandate, but also to join hand with other UN task force to sort of address different vulnerabilities that are arising as new vulnerabilities in the context of COVID-19. So, parents have to be reminded that they are not alone, that sometimes, as you mentioned, it's an opportunity to spend time together and how to capitalize on this and how to work and how to function as a family within these added circumstances that exist. So that's why UNODC has previously worked in conflict setting and stressful settings. And sometimes reaching families in these circumstances of conflict is hard. So Strong Family was a program that requires direct interaction, but that direct interaction cannot always be feasible. So that's why we have created ways of reaching families through leaflets, through booklets, in terms of parenting under stress that have deemed to be very successful, together with also colleagues from University of Manchester reaching refugees pre-COVID-19 with these information. We work also in Palestine together with the Romania office as well to try to provide caregiving in conflict settings. How can you provide this conflict setting? And based on this experience, we have developed specific parenting leaflets and booklets on parenting under COVID-19 in the general population, because every single family is now parenting under stress. But also we have designed specific leaflets that are how to do that parenting when you are in context that is crowded or that is a refugee context. And these tools are available in Arabic and have been disseminated and being used by families in different contexts, including in the refugee context, in an effort for us to leave no one behind and to keep track of the health and safety development of the children, particularly in these circumstances.
Well, speaking of health, can you provide us with an example of how such information of mitigating the COVID-19 situation in a crowded setting can be utilized?
Yes, the health is of crucial essence, and there's so many diverse needs for health in these circumstances of migration, and on top of it in the COVID-19 situation. So there's an element that is related to dissemination of as much information in that context as possible, and use. So in terms of dissemination is key, and there is a need for creative and innovative means of dissemination. One example I can raise that sort of probably links the issue of this innovative dissemination plus merging and consolidating and concerting efforts of health needs among refugees and displaced population or migrant population is an example we have done in Jordan together with our office in Romania, whereas there's in the Zatari camp in Jordan that caters for, it's one of the largest refugee camps in the Middle East, and it caters mostly for Syrian refugees, but maybe others as well. There was a development with colleagues in Jordan together with UNICEF Jordan of a child immunization app that is a kind of an app that keeps track of what children need in terms of vaccination, appointment for vaccination together with the Ministry of Health, and kind of monitors with the parents, sending them reminders of when their vaccination is due. And it's designed for availing that sort of health support to that specific community. And this is where we thought in terms of why, since it's a catering app for that specific community and working actually with parents, why not add these parenting tools that we have mentioned of in terms of how to do parenting under COVID-19 as an add-on for this application. And this was a good kind of a social experience that kind of helped merge two streams of health needs in the same community. Either some parents probably are more interested to see how to parent and how to provide caregiving support in these challenging circumstances, benefited from an add-on experience of a child immunization app, triggering them, of course, don't forget, the value of child immunization, and that comes, and the other way around, parents that are, concerned and that sensitized in the field of vaccinating their children for in this kind of communicable disease context to get more information in terms of how to address mental health and other health needs in the circumstances of COVID-19. So that's one example of bringing two aspects of health together and supporting probably objectives that go beyond the original intent of where the programs are designed, including, I see that in the GCM, there's objective 15 on providing access basic services for migrants. So we're working also under the perspective of the Sustainable Development Goals. So probably one intervention working together, especially working with families and parents, can address several issues, particularly in the context that we're living in of high need and unusual circumstances.
This is a very, very interesting example, Dr. Wadie, and we will make sure to link it in the description section within the podcast. And we are really grateful for having you with us today, and we're very thankful for the listeners for joining us in this important conversation. Is there anything else you would like to add?
Thank you for having me, and I'm sure there are several things that have been mentioned that will be availed for the audience, and if there are any questions or concerns, I'm sure they can address them to us, and we're more than happy to entertain. But these are materials to be disseminated, and I really hope they will reach the families that they need it.
Yes, thank you so much. And dear listeners, please tell us what you think of the discussion, your views and comments in the section below. And feel free, as we mentioned, to explore the links in the description section. And please stay tuned for the rest of the podcast within our Global Compact for Migration series. Thank you.